Hello everyone, it's Dr. Ryan coming to you from my office again with another video review of one of the Step 1 free 120 questions. Today I'm going to take a look at Block 3, Question 2. As always, I'll put a link to the question below this video, but on this slide I've summarized the key points. So this question describes a 25-year-old woman with 3 hours of symptoms. Her symptoms include things like fever, headache, and lightheadedness, also dizziness, chills, and aches. Then they tell you that 5 hours ago she took doxycycline for treatment of Lyme disease. They also tell you she's menstruating and using a tampon, and on exam she has flushing of the skin and diaphoresis. And so based on this information, they want to know what is the mechanism of this patient's condition, and they give us 5 answer choices, which I'll let you read for yourself here in the interest of time. Okay, so this question is describing non-specific symptoms like fever, headache, dizziness, and chills that occurred within a few hours of taking a medication, doxycycline, for treatment of the spirochete-related illness, Lyme disease. And so the easiest way to answer this question is to simply know that this is a classic description of the Jarisch-Herxheimer reaction. The Jarisch-Herxheimer reaction is an acute inflammatory reaction to cell death when you treat spirochete infections. It's classically described with syphilis. Some patients, when they first begin treatment for syphilis, will have this type of reaction a few hours after the first dose of antibiotic. But it can occur with any spirochete infection. It's also been described in patients with Lyme disease. It's been described in patients with relapsing fever and other spirochete illnesses. So in a board question, anytime you see someone who has a spirochete illness like Lyme disease or syphilis, and they get acutely ill a few hours after the first dose of antibiotic, you should think of the Jarisch-Herxheimer reaction. And if you know that, then it's very easy to identify answer choice D as the correct answer. Release of bacterial products from cell death related to the antibiotic producing acute inflammation. Now, if you didn't know that this is an example of the Jarisch-Herxheimer reaction, or maybe you've never even heard of the Jarisch-Herxheimer reaction, you can still get this question right because none of the other answer choices make a lot of sense. So let's go through them one at a time. So we'll start with choice A, exacerbation of infection by Borrelia burgdorferi. This really doesn't make much sense. Why would her infection suddenly be exacerbated by taking a drug that kills the causative bacteria? You wouldn't expect an exacerbation of an infection right after starting treatment with an antibiotic, so this really isn't a good answer choice. Choice B says infection-mediated sepsis. This also doesn't make sense. So sepsis is almost exclusively caused by staph, strep, and gram-negatives. I've never heard of sepsis from a spirochete infection. Maybe it's happened in some rare examples, but this isn't a good answer choice here. And just like with answer choice A, you wouldn't expect sepsis to suddenly start raging in this woman right after you began treatment with an antibiotic. Okay, choice C is IgE-mediated allergic reaction to doxycycline. That is also incorrect. First of all, severe allergic reactions to doxycycline are relatively rare. Severe allergic reactions are much more common to drugs like penicillins. But even if you didn't know that, IgE-mediated allergic reactions usually present with hives and urticaria on the skin and bronchoconstriction in the lungs, and she doesn't have any findings like that. So this really doesn't fit the picture of a woman having an allergic reaction. People who have allergic reactions to antibiotics don't simply develop fever and chills. They also have skin findings. They also have bronchoconstriction and other findings, especially in board questions. And then that brings us to answer choice E, secretion of bacterial endotoxins. So this is the answer choice that some students will pick if they focus in on the fact that she's using a tampon, which can in some cases lead to toxic shock syndrome. But you have to understand this is not the clinical picture of toxic shock syndrome. Although patients with toxic shock can develop these nonspecific symptoms like the things described here, the classic finding is redness and desquamation of the skin, and all she's got in her skin is flushing, which basically just means it's a little bit red. That's something anyone with a fever could have, but they don't describe the major skin findings that you would expect in someone with toxic shock syndrome. Also, once again, this is really not the best answer because her symptoms had an onset just a few hours after taking an antibiotic. It would be an enormous coincidence for someone to have the sudden onset of symptoms of toxic shock syndrome 2 hours after they took an antibiotic for Lyme disease. The much better answer is going to be something that is related to the antibiotic so that was the trigger for the syndrome that the patient developed. So just like the other answer choices, answer choice E doesn't really fit very well with this patient's presentation, and it doesn't explain why she would have the onset of these symptoms shortly after starting treatment with an antibiotic. And that concludes our video review of the Step 1 Free 120 Block 3 Question 2.